Hi guys, this is Jordan Cashwell and this is my community health scan. I did my project on the Say Detroit Family Health Clinic. It's located in Highland Park, Michigan. Highland Park is a suburb of Detroit in Wayne County, Michigan. It's about 10 minutes from downtown Detroit. And a little background on the clinic, although we'll get way more in depth later. It opened in 2008, and at the time it was the nation's first free health clinic. And its goal was to serve the underinsured and the uninsured mothers and children and homeless population of Detroit. And now it treats anyone, whether they have insurance or no insurance. They'll treat everyone. So a little bit of demographics about Highland Park. It has a population of 8,902 people. The median household income is $20,666, so it's fairly low medium income. The population is 90.7% African American, with 50.1% of the population being female, so a little bit more female than male there. And 46.1% of the population lives in poverty. So that just gives you an idea of what kind of socioeconomic status this particular area is kind of dealing with. And I also included an educational attainment chart there, and it kind of compares Highland Park to the rest of Michigan. And as you can see, Highland Park has a very large number of high school degrees, but after high school, it kind of falls off, and there's less 1 year of college, 2 years of college, associate's degree, bachelor's degrees. There's less of that than anything. So most people in Highland Park have a high school degree or less. And then just to give you an idea of the insurance demographics in the Highland Park area, 14% of them have absolutely no healthcare coverage whatsoever. 49% of them have Medicaid or some sort of public coverage. So that just kind of shows you that almost half the population of Highland Park is dependent on that, government-funded help with health insurance. And then 34% have employer-based health insurance, so that's not too bad. And then you see 10% have Medicare, and that serves your 65 and older population. And then 6% have that direct purchase coverage, probably from the marketplace or something like that. Just to give you an idea of the area surrounding the Say Detroit Health Clinic, the area around it is not great. Highland Park is not known to be a great area of Detroit. There's lots of abandoned buildings. Right across from the health clinic is an abandoned lot with an abandoned house right there. And then down the street, there's an abandoned high school. So lots of abandoned lots and alleyways and buildings all around the neighborhood. Highland Park is actually in kind of a residential neighborhood right off of a street called Woodward Avenue. And Woodward Avenue runs up and down Detroit. It's like Detroit's main street. So that's kind of an advantage of the clinic because there's lots of bus stops along the way in Woodward. So it's easier to get to the clinic with all those bus stops. And also, so you see there, Woodward, it's a big street. And also, if you go back, you see like Woodward, there's a picture there. It's about a 6-lane road. So it's very busy. And all along there, there's different like fast food restaurants, liquor stores, shops, stuff like that. So it's a well-populated area, but there's also a lot of abandoned businesses along Woodward too. And then a couple of blocks in the other direction is the Davidson Freeway, which is a big connector. It connects M10 and I-75 together, and those are the two main highways that get you in and out of Detroit. So from that, you can see that really close to the clinic are main ways to get in and out of the area. So that's kind of a plus for the clinic as it's easier to get there than having to take residential streets and stuff like that. The nearest hospital to the clinic is Henry Ford Hospital, and it's 3 miles away. And then Detroit Receiving Hospital, which is probably Detroit's biggest hospital, is 5.5 miles away. So there are hospitals in the area for people to utilize. The crime rate in Highland Park is significant. If you see this chart here compares Highland Park to the US average, and Highland Park is well above the average for the crime rate. It is not a very safe neighborhood. There's lots of theft, lots of automobile theft and assaults happening in the area, robberies. So it's while they're trying to revamp it, it is still fairly high on crime. And as far as the schools in the area, there's one school in Highland Park. It's the Barber Preparatory Academy, and it serves kindergarten through 8th grade. The high school closed in 2015. So once the students reach high school age, they're zoned out to other Detroit public schools. And then just a note that the McGregor Public Library closed in 2002. So there also is no public library in the area either. So going into the clinic, as I said, it was opened in 2008, and the goal when it was launched was to treat the homeless, underinsured, and uninsured women and children. It was launched by the Detroit Rescue Mission Ministries, which is a nonprofit organization in Detroit whose main mission is just to better Detroit. They do soup kitchens, clothing drives, food drives, everything like that. They get donations and fundraisers to put all these things on. And in 2008, they put all their backing into this family health clinic to provide free services to the people of Detroit. And now, years later, it serves everyone in Detroit, whether you have insurance or not. And they accept all sorts of different insurances. So you can go there if it's close to you or if you feel it's better going there than somewhere else. And then in 2019, Trinity Health became a managing partner of the health clinic, which is great for them because they immediately revamped the clinic, brought in new machines, new equipment, and kind of redid the waiting room and stuff like that. And also they provide the doctors, nurses, and nurse practitioners to the clinic. So, and that's really good because the clinic sees over 4,000 people annually. So it's very helpful to have that extra backing because they only have 10 full-time employees at the clinic and everybody else is a volunteer rotating staff from the community and from Trinity Health. Here are the services that's offered. I won't go into all of them, but as you can see, it's pretty much what you would expect from a general practitioner if you go see your doctor. What's great is they offer like health education and weight management classes too, along with just your annual testing for hypertension and cholesterol, diabetes, all sorts of stuff like that. And they just got a laboratory machine so they can do labs in-house. So that's really awesome too. And during COVID, they were able to do 1,500 COVID tests for the people of Detroit. And they went out into the city with like a mobile van and did COVID testing and vaccines. So if people didn't feel safe coming to the clinic, they could still get the help that they needed. They also offer Wellness Wednesdays, and it's a support group for women and mothers of Detroit. They meet once a month, and last month was October, so it was Breast Cancer Awareness Month. So here was the flyer for it, and it was all about breast health and breast care. So that's very helpful for the women of Detroit. And then they also offer first year. It's called Strengthening Your Baby's First Year. So it's a free program for moms and babies to get through their first year. They work with case managers and nurses and community health workers to just learn about how you and your baby can, get through that first year. And that's very helpful for, maternal death rates and stuff like that, mortality rates to go down. We really need programs like that. So some of the strengths of the clinic, obviously, it's, one of its kind in the area, a free health clinic serving this particular area where otherwise they would not get this kind of healthcare that they need. And like I said before, there's multiple bus stops along Woodward Avenue, so it's easier to get to this clinic than perhaps the hospital. Partnering with Trinity Health has, afforded them to do clothing drives and food drives and other things in the community, including opening the Ernest T. Ford Recreation Center, which is 1 mile from the clinic. So that's great for kids and adults to get in there and work out and take classes and stuff like that just to better their health. They have great opportunities with, community outreach. They just hired a community outreach planner that goes into the neighborhood and educates people on the clinic and on their health. And, they're just trying to get out there and educate more people and so they can treat more people in the community. Some of the weaknesses is being on a busy street like Woodford, there's lots of fast food restaurants around the area of the clinic. There were no grocery stores that I saw within walking distance and no parks along the way either. A lot of abandoned buildings and stuff like that, which falls into our threat category of, it's a high crime rate area. And also those abandoned homes and abandoned lots just attract, possibly the wrong kind of people. And also a weakness could be that it's the only one of the clinics, only one of its kind, so that there's longer wait times as well. Some important policies, the Blue Light Project was set up so that they put cameras in the streetlights of high crime areas to kind of deter criminals from coming in there, and the police monitor that. and also for Food Secure Detroit, which provides access to healthy food and promote healthy eating to the people of Detroit as well. Some of my recommendations would be adding new clinic locations and expanding outreach deeper into the community to get more people involved, create mobile clinics to go into Detroit and educate people more. And those mobile clinics can actually help people more and, have special days like hypertension days and cholesterol days where people know they can come in and get certain tests done, and just improving the community around it. Fix empty lots and plant trees and pick up trash and just make it a better community for the people. And I think it's a really great clinic and it's helping a lot of people. And that's it. So thank you very much. Oh, and also there's a little YouTube clip if you want to see more about the clinic. They did a little news thing there. So check it out. And I hope you guys enjoyed this. Thank you.